Okay, thanks, Bill. So Seth, when you're ready, just let me know.
Mr. Long, you are good to go.
All right, thank you, sir. All right. Good evening, everybody. Welcome to the August 16th, 2021 Scituate School Committee meeting. In response to Governor Baker's declaration of a public health emergency and the related emergency executive order dated March 12th, 2020, Town of Scituate public meetings shall meet remotely until further notice. This meeting will be recorded and will be posted following the meeting. Public comment will be available through Zoom, and community members can also reach out, email me, mlong@cit.org with any questions. So tonight's meeting was scheduled last week in order to allow the school administration and our medical advisory council to come and present to the school committee and to the public just regarding the return to school and making sure that we do that as safely as possible for our staff and our students. There will be one opportunity for public comment after the presentation is completed. At that point, wait with the rules for that later on, but we will allow everyone who's come on that wants to speak tonight to take the time and make a public comment. Whether it's 2 people or everyone on the meeting, we will make the time to make sure everyone has that opportunity for public comment. So at this time, so I'm going to do a roll call just to start the meeting. Long, yes. Gates?
Yes.
Lindblom?
Yes.
And Brenda.
Yes.
Thank you. So at this time, I will turn it over to Superintendent Burkett.
Thank you, Chairman Long and School Committee. Good evening, everyone. I will be presenting tonight with school nurse leader, Ms. Kelly Roach, and I'll introduce the rest of the MAC team, most of who are present this evening, to assist with any follow-up questions the committee may have. So I want to share my screen. Okay. But I want to start off with a lot of the good news that's coming out this year, and to keep things in perspective. Tonight we'll offer 2 options, but no matter what the decision is, there's still a lot of good things happening with coming back to school this fall that we're excited about. And the first 2 bullets are that all districts will be required to be back in person this fall, September 8th for us, for students, and school will be in person full-time 5 days per week. And I know that's music to most people's ears, or pretty much all people's ears. I know it is to mine, and that's pretty solid. Down below, I just put the goal there to simply and safely maintain this model for all students throughout the school year. So we want to stay in school, we want to stay full-time, and we want to stay with the in-person model. And just wanted to kind of preface that with putting that up front, that no matter which model is decided upon ultimately by the school committee, we still have full in-person school ready to rock and roll on September 8th. So for those that are new or may need a refresher, the Medical Advisory Committee is a group of folks that we put together last year when we had to make about 30 or 40 of these major decisions involving back to school with multiple plans, multiple contingencies. And we found that there was a lot of conflicting information out there, vague guidance. And so we decided to make a strong local group consisting of administrators, medical staff, and medical professionals that have the best interests of Scituate at heart. And I'll start with those folks. Dr. Stephen Lane is a local Scituate school physician. He's a family physician. He's also a U.S. Coast Guard Point Allerton physician. Unfortunately, Dr. Lane is on vacation this week and won't be here, but has been to our meetings. We've had, just to point out, multiple meetings in preparation for this evening, but also since last year. We met weekly and we met daily in a lot of cases last year, and this group is willing to and committed to doing the same this year to keep an eye on things as we progress through the year. Next is Dr. Katie McBride, who is from Scituate Pediatrics physician, a local Scituate well-respected physician. Again, both year 2 on this committee. Next is Drew Shealy, our Scituate Board of Health Director. Eileen Scotty, Scituate Public Health Nurse. Myself, Superintendent. Dr. Robert Dutch, our Director of Business and Finance. Kelly Roach, our District Nurse Leader. Ellen Claflin, our High School Nurse. Kim Peters, the Executive Assistant to the Superintendent. And last year, we also reached out to Dr. Todd Ellerin. We didn't have a infectious disease specialist on our committee, and we looked for the best local and most respected, and there's probably several, but Dr. Ellerin, if you could recall, those that were here last year, actually attended a meeting, spent time consulting with us, came to a school committee meeting during a Q&A session. And he is the infectious disease specialist and director of infectious disease and vice chairman of the Department of Medicine at South Shore Hospital. And also, I believe he contributes to many local news stations. You've probably seen him on TV. I recommend Googling him. He received national prominence when COVID broke for his guidance on that. So we reached out to him to get some direction, and we'll share his perspective also on that. So the MAC, we rely on multiple medical advisories, the American Academy of Pediatrics, the Center for Disease Control, or CDC, the Mass Department of Public Health, and guidance from the Department of Elementary and Secondary Education. So trying to keep things as informational as possible to give you all the information we could and go by the data that we have and that hits local. We'll share this slide, and basically this is a number we used last year in our reporting out, the percent positivity that comes from the state. And you can see there over the last, we started in the end of July, it was 0.52%, 0.31, 0.64, and recently has jumped to 1.93%. Then to break that down, our local Board of Health numbers of cases per week, you can see there, the week of July 22nd, there were 8 new cases, and then we broke it out a little bit further to show cases under the age of 18, school-age children, and there was 0 at that time. The following week, we had 20 new cases, 7 of which were under 18, and the most recent numbers have jumped to 26, with 8 of them being children. So and again, Ms. Roach, if you want to ever jump in while I'm going, just please feel free to do so. But I think that one's self-explanatory. And
Bill, we can only see the the first 2 dates. Can you scroll up or anywhere to see that bottom line, the most recent?
Oh, I can't, but I'll read it to you, I guess. The date is 8/6/21 to 8/13/21. Do apologize for that. Total new cases were 26, and new cases under the age of 18 were 8.
Okay, thank you.
Thank you. Okay, the next one. So I'm going to turn this over to our nurse leader, Ms. Roach. We thought it was important to have the most up-to-date information that we have. We're proud of our families and our kids for getting vaccinated, but we wanted to give you this information, and I'll turn it over to Kelly on how we access this information and how current it is.
Thank you, Superintendent Burkhead. So the slide you're looking at here is our vaccination data for our kiddos, and these are for rising grades, so incoming 7th graders, 10th graders, etc. What you're seeing is at the top of each column, how many students are in each grade, how many students have been fully vaccinated, how many have started the process with 1 dose, how many exemptions have been provided to us, and then a breakdown of what that percent is for each grade. And we got this data from parents that have sent us, or physicians that have sent us, documentation for students, as well as the Massachusetts Immunization Information System. And what that is basically when your child gets a vaccine at your pediatrician's office, it gets entered into the state database, and that's where this information comes from.
Thank you. So we've broken it out into a Plan A and a Plan 1, for lack of better choices of names. In this Plan A is basically the DESE DPH recommendations. That came out on July 30th. Kindergarten through grade 6 would wear masks when indoors, except for students who cannot do so due to medical conditions or behavioral needs. Masks are not necessary outdoors and may be removed while eating indoors. Unvaccinated people who must wear masks indoors, unvaccinated people who must wear masks indoors include staff in all grades, students in grades 7 and above, and visitors. Next, it says schools shall allow vaccinated students, and I think this would include staff as well, students in grades 7 through 12, to remain unmasked. Any child or family who prefers to mask at school should be supported, whether they're vaccinated or not, meaning if you choose to mask, then that obviously is your right. And then the last bullet here is all students and staff must wear masks on buses and while in school health offices. So that's summarizing in a nutshell the new guidance from DESE without adding anything to it. Again, this is a little more simplified, but this is the other plan, Plan 1. This plan is supported by the American Academy of Pediatrics, the Centers for Disease Control and Prevention, and Dr. Todd Ellerin, who I referred to earlier in the meeting, has also recommended that we start the year at least with this recommendation of fully masking all students and staff in the schools. So what they both say in very similar terms is recommendation indoor masking for everyone older than age 2, regardless of vaccination status, is the AAP, and the CDC has recommended universal indoor masking by all students age 2 and older, staff, teachers, and visitors K to 12, regardless of vaccination status. So worded slightly different, but that's basically a all students, staff, and visitors K through 12 fully masked is this plan. So what's it look like in practice as we tease these out next to each other for a better view of it? Okay, so the Plan A in practice would be K to 6 students wear masks indoors, unmasked outdoors, because they haven't been vaccinated yet or have the ability to do so. All students wear masks on transportation. All unvaccinated staff wear masks indoors. 7 through 12 unvaccinated students wear masks or are recommended to wear masks, and this is recommended by DESE and DPH. So next to that, Plan 1 in practice, all students K to 12 wear masks indoors. It's important to point out in this plan that folks are able to, students and staff, to be unmasked outside. So both plans have that option to be unmasked outside. All students wear masks on transportation, similar to Plan A. All staff wear masks indoors, and this is recommended by the AAP, CDC, and Dr. Ellerin. And then physical distancing, there really hasn't been a lot of information from anyone out there on this. So we're just including what we have because of the importance of in-person learning. Schools where not everyone is fully vaccinated should implement physical distancing to the extent possible within their structures, but should not exclude students from in-person learning to keep a minimum distance requirement. And that was mentioned in the DESE and the CDC guidance. I think the recommendation for all of us would be to do as much as we can, but also I think keeping in mind that there's a lot to be said about group work in the elementaries and middle school and high school, and that type of stuff. So I think we want to keep that to a minimum. We want to return as normal as possible, and so there's a lot of good news there that we can have minimal distancing in both plans. Except for lunch where masks are off, we would certainly have to consider some type of distancing there, depending on the plan that's chosen. So some important considerations. One of our models last year was safe and strong. go slow to go fast, to be smart about our decisions. So we have to understand that we understand fully that everyone has their own children. We've heard from a lot of folks. We're going to hear from a lot of folks tonight. We appreciate that. Thank you. It's the responsibility of the school committee and the medical advisory committee that the health and safety of all 4,000 people that will be entering our schools pretty soon to be considered. And I think we did a real nice job of that collectively last year as a school community. Protect all student, staff, and community visitors. Regular routine and emergent, if necessary, MAC meetings. So no matter what plans decided upon, the MAC team will meet regularly to look at numbers, to assess data, to look at recommendations from the AAP, CDC, DESE, and comparable districts and towns. So all that will be considered in the decision, no matter what decision, because we know COVID is ever changing. The school committee has the opportunity to switch gears as we continue to monitor. So we will continue to meet. Wanted that to be very clear to everyone and to monitor the situation throughout the year as we had in prior year. To also monitor state and town numbers that we share with you tonight. And it's important to understand the practicality of implementation of each of these plans. So no, a question might be, well, in plan one, or excuse me, plan A is, how are we going to know if everybody's vaccinated? Well, we're not going to be checking everybody's vaccination cards. It's going to be, a lot of it's going to be the honor system. So understanding that and basically the practicality of that. What's not also not in this presentation, because it just came out on Friday, was new guidance on testing and quarantining. So there's some good news about more real-time testing, the ability to quarantine less students and staff with more testing, and we'll be sharing that out at a later date. Again, that's and again, I think it's all positive news for us. And then watch for and report any school transmission. I think because of the mitigation strategies we had last year, there was next to none transmission in our schools, and we're really proud of that. And again, that should be our goal again this year, and something we continue to look for and document and share with our community. And respect and acknowledge mass exemptions, no matter what plan. If there are students that are not able to wear masks for whatever reason, that's documented, that should be respected and will be, as it was last year. And then moving forward, we appreciate the very difficult and challenging decision that the school committee has to make. We're hopeful these measures will be temporary, and we'll continue to adjust our protocols based on advice of our medical and public health advisors. So again, I think I mentioned this as the presentation went on, but I want folks to understand that as we've learned in the past, that as things change and as the data changes and new information comes out and new guidance and direction from all the medical advisories come out, we're able to move soundly and safely and smartly. So it's whatever the decision by the school committees on these options, it may change depending on information that becomes available as we progress through the school year. These are references we'll include, and again, we'll get this presentation out to folks and post it if you couldn't make the meeting tonight. We want people to have access to it. And then for those that weren't aware, we had started an email, safeandstrong@cit.org. If you don't feel comfortable tonight speaking, or you think of something after the fact and want to shoot us an email, or would prefer that method of communication, this goes right to an inbox. There's we collect it, we read it, we collect the data, and it helps inform our decisions. So that's been really good. We used it last year for a lot of our decisions similar to this, and it was one more option for our community to be involved and share their input. And that concludes the presentation for tonight.
All right, thank you, Superintendent Burkhead. Before I open it up to any questions or comments from the school committee, I do just want to set the stage so everyone is on the same page. So the school committee does have a policy It's EBCFA face coverings, if you look at it on the school website. And it does currently say that a face covering that covers the nose, mouth, and chin must be worn by all individuals in school buildings. And then there's, you don't need one if during mass breaks, while eating or drinking, or while outside. And that policy was one that we approved last year and remains in place until rescinded by the school committee. We are not voting anything tonight. A vote or a change to that policy would occur in our meeting on August 30th. So tonight is really just to get information from Superintendent Burkhead and the Medical Advisory Committee and get that out into the public. So anything that does change would occur in our meeting on the 30th. We've received dozens of emails from people in the community, which has been great because it's really helped us understand where the community stands, as well as all of the information that they provided, whether it's a link to a CDC website or another, whatever their wherever that information is coming from. And as Superintendent Burkett had mentioned, whether it's later tonight or over the next 2 weeks, anyone from the community should feel free to either email that safeandstrong@cit.org or to email the school committee with any questions, comments they have after tonight's meeting. So what I'll do now is I'll open it up to the rest of the committee for any questions or comments that they might have.
Mike, I have a couple. Or well, I'll do one, and then Janice, you can go next. How's that?
Fine.
I have a couple. I'll just start with one, I guess. I'm not sure if I missed it, but is the MAC making a recommendation on which policy to utilize or which option?
Yes, it wasn't in the presentation, but the MAC unanimously supports Plan 1, the one that was supported by the CDC, the AAPA, and Todd Ellerin.
Okay. I have a couple more. Janice, you want to go, or do you want me to ask the next couple?
No, go ahead. I'll wait till you're done.
All right. Let's see. I guess my next question is, I know Superintendent Burkhead, you mentioned that the MAC is going to meet regularly as necessary. Can you or can any of the committee members comment on maybe what metric you would be looking at to determine, or what they would be using to determine any potential change in their thinking or in their recommendations?
Yep, I'll take a stab at it first, and I'll turn it over to anybody on the committee that wants to jump in, because we've had this conversation. I mean, right now we don't have a metric. I mean, last year it took us a little while where we came up with our own because we didn't get any from the state. It'll depend on state guidance that's, we know, changes pretty frequently. Also, we've had a history of looking at what the AAPA and what the CDC has to say. So all that guidance would be analyzed along with our local numbers, percent positivity, the count in the town, those charts that we showed this evening, we continue to use those. So I think the same process where we came to this presentation would be, using the same analysis, and then, advising the school committee as that information changes or becomes available. Is there anyone else that wants to add to that in the committee, or?
Yeah, I think.
Go ahead, Kelly, you go first.
Sorry, I was just going to say, I think too, we look at all of those that you just mentioned, Superintendent, as well as in-school transmission. And I think that's really important, what's going around locally and what's going on in our schools. And I think that's an important thing for us to look at.
And I would also like to add, just, as a town-wide metric, the numbers that Kelly put up were public school students. I'm actually looking at the numbers for town-wide vaccination rates. And we have, of our 16 to 19 years old, we have 82%, and that's including the private school kids too. So these are just numbers that are out there. And if we do go with Plan 1 and other communities go with the unmasked high school, we're going to get to look at their numbers, look at their vaccination rates, and So within 30 days, we should be able to see if there's any kind of trend going on. The Delta variant is that transmissible that I think that you might be able to make, adjust things as we get more information by seeing what's happening in other communities around us that are similar.
And I think one of the other things that we have to look at is also what is our capacity right now. So South Shore Hospital Pediatrics is overfilled. Boston Children's Hospital, MGH, Tufts. I mean, we have a lot of kids being admitted to the hospital and the PICU right now, and lots of places are at a lot of capacity, and it's not COVID, it mostly anyways, right now, but it's trauma because that's what we see in the summertime, but it's also all of the respiratory illnesses that we protected ourselves from by wearing masks last year have come back in full force. So it's full of croup, it's full of RSV, it's full of all these really sick respiratory kids. And so, we do have to keep in mind that we unfortunately have limited resources, and to add another thing to the mix is potentially really dangerous. So it would just be one of the other factors is where we are at capacity to hold kids who get really sick.
Okay, thank you. I have, I guess one other one. Maybe Drew, this is maybe for you. I'm not quite sure, but I've been reading about other local towns across Massachusetts whose towns have initiated a mask policy on public buildings. Is that something that the Board of Selectmen would be in charge of, and are you providing them guidance on whether or not to do that? And if that did happen, does that take precedence over the school committee's policy?
I believe that the Board of Selectmen, with input from the town administrator and the Board of Health, would make that decision, and that would be separate from the school department. Does that answer it?
Yeah, I was just reading some other local towns, and they say all municipal buildings are required to have face coverings, and generally they say this includes, I assume it includes school buildings as well.
I'm not sure if it does. You'd have to.
Okay. Okay.
I've said this before. I'm not a big fan of, being more strict than what the state is. Our numbers don't call for that right now, so I don't see it happening. But
okay,
you never know. It could mutate to something else, and then it's a whole new ballgame. But as of right now, I don't see that happen.
Okay. All right. That is, I guess the only other comment was that there was no option for fully mask optional, correct? K through 12 mask optional. That was not considered by the MAC.
Yeah, yes, it was considered, but it was in none of the guidance that we could find, especially where there was no availability of a vaccine for children of that age. We felt that that would be irresponsible.
Okay. All right, that's all I have for now. Thank you.
Welcome.
Janice, before you go, can I just ask a follow-up to something that was just said?
Sure.
Drew, I think it was you that said this, but you had mentioned that we're looking at other towns in the area that are similar to us. Are you also considering the things that are happening in the South, like Florida, Louisiana, Georgia, where they are back in school now, and they're seeing spikes in COVID cases down there, and talking to some people that I work with down in that area are starting to look at using masks as opposed to having a mask optional approach down there?
I don't think so, just because their vaccination rates down in the South are a third of what we are here in Massachusetts. But I mean, nothing's off the table if we're looking at things it's all about keeping kids safe, so.
Okay, thank you. I just wanted to clarify that point you made.
Yeah.
Sorry, Janice, go ahead.
That's okay. I do have a few questions. Well, first I want to say, I think how lucky Scituate is to have our MAC team in place. I don't think, Bill, you mentioned to me that not a lot of towns you'd think have it. So I want to thank everybody that's on that team for helping us through these very difficult times and just with helping us with our decisions. I have a question for Kelly Roach. You mentioned that the information that you get with the number of kids that are vaccinated coming from pediatricians, does that also include like the Marshfield site, the mass vaccination sites too?
Yep, anybody that's registered through the mass immunization information system will come to us, and many parents that took their kids to those sites voluntarily just sent along those cards, copy of those cards to us.
Okay. And I have a question for Drew. So in looking at the information in the presentation, it looks that to me that the positivity rate has more than doubled over the course of a week. Is that correct?
I believe it's at 1.93 right now. I can't remember what it was last.
It was like
week, to be honest with you.
from like 0.64.
I don't think it doubled. We did go from, I believe, 18 cases to 26 cases in the last.
Okay. And I guess I want to, hop on what Dr. McBride said about the increase in the kids in the hospitals with the increase in not COVID, but RSV and croup, and that those things are popping up because those kids aren't wearing masks. I think that's an important takeaway from that. And I think everybody can say that, wearing the mask, we saw a lot of a decrease in a lot of other infections. I've heard people say that, not a lot of people just getting colds through the winter, a lot of people, we weren't seeing a lot of that. But I maybe Dr. McBride can answer or explain what I've heard about the Delta variant, that its viral load is extremely high compared to COVID-19. And that's what makes it even more transmissible and infectious. I don't know if you want to add to that or.
Yeah, no, I mean, I think the numbers are somewhere around like 1,000-fold. So when you look at the original Alpha COVID, they use this R number, which is how many you can infect when it's around you. And I want to say it was somewhere around like 2 to 3 people, right? If you got it, that's about what you were looking at. And the number for Delta variant is, I see it kind of ranging a little bit, but it's somewhere around the 6 to 9 potentially. So that's a lot more people that you're infecting, right? Yeah. So yes, it's far more contagious, and so we're seeing it in a lot more families and kids, and more so than we did with the original.
Okay. All right. Thank you. That's all I have. Thanks.
My turn, I guess. So I had a question I guess this is for Superintendent Burkhead, maybe, that 6th graders under the first plan, if you turn 12 or you are 12 in 6th grade during the school year, will they regardless have to, under that plan, remain masked? Or once they're 12 and vaccinated, they could potentially unmask and that's that? Or is it just that whole 6th grade group is sort of masking?
I think the school committee ultimately has the flexibility to adjust all these plans. I should have said that as well, but under this current plan, back to that practicality of implementation and keeping track of it, this would be K through 6. That was the DESE guidance. Not sure DESE understood that most school districts are K through 5, 6 through 8, or, so don't know, I know that was trying to keep it under 12. That was the rationale. Again, so it gets hard to keep track of, and you also got this middle school kids, with 7th and 8th graders that under that plan would not necessarily have to mask. So currently under the plan for practicality and for ability to implement, it would be all students for the 6th grade would wear them. Unless I was directed or we were directed to adjust that.
All right, that makes sense. So I guess to follow up with that, I know you mentioned the new guidance that came out Friday about close contacts and quarantining. Do you and the MAC team, and especially Nurse Roach, do you feel like the tracking and almost policing, if you will, of all of this is a factor in your selecting the other plan for the district? Is it going to jam things up a lot with if the variant is so much more contagious, and are more people going to be out of the buildings potentially?
So,
Is that a factor?
so we're just digesting the testing that they're offering to us, and we can certainly explore that. I think we can make whatever happen that we need to make happen. And I really do believe that. They're offering us support for testing. Things are going to look a little different than they did last year. So I'm going to hold on my response to that until we fully digest and get all the information we need to make a good decision. That's really all I can say about that at this point.
Yeah, just thinking from the perspective of a classroom teacher or building leader or anybody in a building working, last year, the stress of someone being out, even if it was like a colleague or something, it was like, that person's out. Okay. It's just that added stress and anxiety of COVID detracts from, in my opinion, a teacher's ability to fully 100% focus on the kids. I know they do amazing work and the best possible, but you can't help but be nervous when you're in a building and people are like, here one day, not the next. So I'm just curious if you were thinking that plan would create that kind of anxiety.
I think my personal opinion, I think obviously that would mean more policing, like you say, and more watching who's vaccinated, who's not. But like I said, depending on whatever decision is made, we can make it work.
Okay. And were you all planning to follow, maybe this might be a Dr. Dutch question even, adhering to the same cleaning and hygiene protocols as were in place last year at the end of the year, 3-foot distancing, just everything kind of essentially normal for lack of a better word, but just, are we keeping all the cleaning protocols in place as they were?
So those decisions haven't been finalized. Obviously the cleaning in the evening, we make sure that we're doing that. But part of the challenge is that there hasn't been any evidence that this is transmitted through surface contact. So certainly we wouldn't be fogging between, during the middle of the day or at any point. Still haven't determined whether we'd fog in the evening or not. Kind of looking for some guidance on that as well.
Okay. And then my only other question in one of the concerns for students and students receiving special education services in that area is making sure, and also just our children in K-2 and who are learning to read, data from spring and looking at our scores and things and worrying about them learning loss wise and masking. I'm sure you are all being very creative with ways to move forward with that. So I just wanted to bring that up as a concern in terms of, kids receiving speech and kids learning phonics and reading, that, we have them able to, be safely reading and learning how to read in the classrooms and in their small groups and, individual services.
Yes, I will let you know that we have, researched that certainly, and we've got what we're calling acceleration academies coming out that we'll be introducing at the next meeting that will identify all the areas of growth that we found through our data that we need to improve for this year. The good news is they will target every single student in the district will have an opportunity to attend one of those acceleration academies. And the beauty of that is there'll be a lot of creativity and across the district involving our educational leaders and principals and department chairs and central office team and coming up with what they look like based on what our students need. So the good news is you'll be hearing a lot more about that and what we're providing for all of our children and trying to meet all their needs. And I look at it, and I think we gave a presentation last year. The good news is the loss. Some people were out there, and not just Scituate, everywhere, where the learning loss, and we don't even use that term because it's I think it's looking back at other years, I think it's the same type of evidence that we were seeing. Some kids are behind and some kids thrived. We learned a lot of good things. I think the good news is we're going to use what worked really well last year, whether it's a Zoom meeting when a kid's home for an elongated illness, or whether it's to connect with parents that can't make it into the schools, or there's new type of learning that we found from last year that we will implement. So all those conversations are already happening, and then new creative ideas on how to not only support students that may have fallen behind, like in past years, but also to look at how we can accelerate all kids' learning so that every student will have an opportunity to participate if they and their parents choose. So we'll be rolling out those acceleration academies, and that's something we're really excited about for all kids.
Okay, thanks. I just had one last comment before I'm completely done, Chairman Long, but I just wanted to add my own perspective professionally. So as a building-based elementary adjustment counselor, my job is to make sure kids are learning and accessing the curriculum, and there are no social emotional barriers for them to do so. And from my perspective in my building, I just wanted to add to the conversation that, I work in a building with 600 kids between the ages of 4 and 10, and I never had a student in my office that was upset over a mask or anything. So I never had any students who came in with any kind of masking issues, certainly pandemic related situations, absolutely, and anxiety and, other things from isolation. But I had never seen any specific incidences in my professional setting in relation to specifically masks. So I just wanted to add that kind of mental health lens as well.
Great, thanks, Nicole. I just have a couple of hopefully quick questions. Superintendent Burkett, I know we keep talking K to 12. Can you just confirm for us what would happen for pre-K students? So it's someone either in the ECC or in the ages before kindergarten?
I think it would be the same. We probably should have put pre-K in there. We know it's tough for the kids that young, and we did a real good job, our staff and school personnel, to make that work. So we would do the same there. They would be included. Thank you for clarifying that.
Okay. And then in terms of I know Nicole brought up students with hearing and speech issues. Do we have any concerns with having to rewrite any IEPs going into the school year, depending on whatever decision we make, or should those be covered just based on how they stand today?
Yeah, I would say no, but I'd like to direct that question to Dr. Boebert. You want to give that a shot? Can she unmute?
I just have to unmute.
Okay, said I couldn't unmute myself, so no, I mean, because we're just continuing what we did last year. So there would be no need to, change the IEPs. Like Superintendent Burkhead said, the exciting thing is we're starting full in person 5 days a week. So kids will continue to get their IEP services. I'm looking forward to a start, even with masks, as typical of a school year as possible. So there shouldn't be any problems implementing the IEPs.
Okay, thank you. And then I know, one of the concerns is that we've gotten from a number of people is just, the use of masks. And one thing that I've seen in a couple of emails is, if you're using just a regular mask, it's not airtight against your face. It's something that, kids could still touch their desk and then touch their eyes or touch around their face, and all of a sudden they could potentially get the, COVID that way. Based on the information that we know about the Delta variant, is there any recommendation on the types of masks that students should be using? Obviously something that's available for everybody, or as a mask that we did use last year, something that would still work well for our students and staff.
I asked for Dr. McBride if she could probably chime in on that question, and then I can share that we did allow families or children to choose their mask, and then we did provide masks for them. We also provided our staff with masks and the option of KN95 masks, I believe they were, for some staff that may have needed them. I'll turn it over to Dr. McBride on the science of that, I guess.
Yeah, no, it's a great question. Obviously, the better filtration you have, the better the mask is. But N95 masks are really hard to wear. I don't know if you can see this. I mean, I'm wearing N95s at work because I'm seeing positive kids, and those are really painful. And no one's going to wear those, but those are going to be the best, right? But they're also ridiculously expensive. I think when we look at most mask studies, it's kind of recommended to have a 3-ply mask. So as long as it has like 3 layers to it, most of it is like a 2-layer cotton mask with some sort of kind of filter in there. You can buy the masks now that kind of have those situations put in there. Again, some of those are more expensive than not. There's, you guys want a list of companies that have higher filtration masks? I'm happy to give parents lists of companies, but they're being sold out. I mean, parents are buying these things up right and left. There's a shortage now of KN95s, and then the numbers are skyrocketing for that because parents are using those. I mean, again, those masks are great, but looking at just masking in general, there was a really great study that came out from Duke just recently, fresh hot off the press, that looked at 1 million kids. And these are not 1 million kids that had high-end masks. These are North Carolina 1 million kids looking at just general schools. And they just said mask in general. So just something. I mean, this is how it works. It's respiratory droplets. So while the virus is really small, as long as you can contain the respiratory droplets, you're going to be effective. I hope that answers the question. I don't know.
Nope, that does. Thank you. And I know, especially, if we make a decision on the 30th, and let's just say we make it to go with masks, and, I don't want parents to have to try to find masks on the fly. And obviously, like you said, everything's sold out because people are already purchasing everything. And I guess that kind of leads into another point, that question I was going to have. So you just referenced a Duke study. There was a list of sources that the MAC was using in order to come up with their recommendations. Are there any other, are we constantly looking at the types of sources that are out there? I know everyone can go out and Google and pick, find a study, and whatever they see may or may not be accurate. And, we've gotten emails that reference probably 30 different studies that I could go back and pull. Is there a recommendation coming from the MAC on where the information is coming from, or just generally, based on the research you've done, what parents should keep an eye on or focus on as we move forward over the next couple of weeks, couple of months?
I think it goes back to that slide we used, that we look for the the American Academy of Pediatricians, the CDC, medical experts at our Mass Department of Public Health. Again, Dr. Todd Ellerin, who's an epidemiologist. We also have a contact in DESI that's an epidemiologist that we contact. So those are our sources that we shared earlier and that have been consistent with us, for us. And again, I think what we've seen and what gets kind of confusing is those resources that we use have been around a long time, have been research-based. And I think for every pro-mask study out there, we've all known this, we received an email about masks on the other side. So I think we need to be careful of that. There's 1,000 articles out there. And again, we want to be upfront, very transparent. This is who we use and why. And I think there was inconsistencies last year with the AAPA and the CDC. I think they're on the same page here. And they're on the same page with our local physicians and with Dr. Ellerin. So that's, if anyone else wants to chime in, but that's kind of where we've been relying on, without getting too far in the weeds on, our doctors and we're all reading all the current research out there. But again, there's so much stuff out there. We want to make sure that we're looking at, best practices and research-based articles that are valid.
Okay. No, I just wanted to, make the point that it sounds like everything you've told me so far is, everything's been research based, and I think that's the best way to go to make sure that we have as much, solid information as we have when we make a decision. But, like I said, we're getting sources from all over the place, and I want to make sure that we, that if there were any recommendations from the MAC that we just heard it tonight. And then the last, I guess, comment that I was going to make is obviously as we come back, there's a huge social emotional piece for our staff and students. I've had kids tell me that they don't want to wear masks because it's a detriment to how they feel, going in and day out. And this is probably more for Superintendent Burkhead, but as we move forward and we get back coming into school, making sure that we have the resources, whether we wear masks or not, or require masks or not, just so that as people come back into the schools, we want them to be happy. We want them to, be smiling, whether they have a mask on or not, feeling comfortable in school, and at least knowing that if they do have any concerns or issues from a social emotional piece, that we have the resources that we can either, have them within the school or talk to parents and students and guide them to the right way to make sure that they, they do feel comfortable and they continue to, come into school happy and with the mentality so that they can succeed in all of their classes.
I think it's a great point, Chairman Long. And yes, we have. When we on the 30th, we'll be talking about our two pillars this year, and one of them is a culture of academic and personal excellence. And that academic piece obviously speaks for itself and how we can support our students. And then the personal piece is that home away from home philosophy. I think that's really important this year. Is that we treat our school like it's a family and it's a home, it's a safe haven for all of our students. They're cared for, treated with respect. And, we realize that kids are coming back with some sort of trauma, and the adults for that matter. We spent a lot of time on how we can, balance that personal piece, that value-driven, if you will, education, so that we're taking care of the kids, we're taking the time to talk to them, to listen to them, to make sure that they're comfortable coming to school, they feel safe, they feel supported. And I think the first way you do that is by getting kids back 5 days a week in person in front of our great teachers and support staff. We didn't have that for over a year and a half. So I think that's a huge thing. We want to keep that in place. We've got outstanding professionals that are ready to do that. And we want to work closely with our community. And it's one more lead into tonight, no matter what the decision is, and I understand there's people with strong feelings and are passionate about both plans or the mask versus the no mask. I think we should also consider that we are Scituate, we are a family, we are a community. And I think no matter what the decision is made on this, we're going to have a lot going on with our kids coming back. And we have high expectations that we're going to soar this year. And we can only do that with everybody's support. So no matter what happens tonight or the 30th, what the vote is, it's my hope that we can all rally behind, that culture of excellence for our children, and that we can work together to make it happen, independent of what decision is made here. And I firmly believe we can do that. But it does take a community, and it's going to be hard. And again, we have a plan, but also that plan involves the school community, which is parents and caregivers. And we have to work together, and we have to be civil. We have to be respectful with each other. We certainly don't have to agree, because that's the best part of having a great school system and a great family, for that matter, is that you don't want all yes people. You want people to challenge your beliefs. But at the end of the day, you want to do it civically, and we want to model that for our kids, that we want to be responsible. We want to be safe. We want to give them the best opportunity to be the greatest they can be. So that's going to be a lot of our focus this year. It's going to be on that excellence, not only academically, but also personally, and how we can create schools in a district that are cultures of support and love and excellence. So you'll be seeing a lot of that when we roll that out on the 30th and ongoing, that we are making that two pillars, one that's not only academic, but it's also personal and deals with the social, emotional needs of all of our kids, which we know, and adults for that matter, we know exists. So we will be prepared for that, and we're looking forward to that challenge.
Great. Thank you, Superintendent Burkhead.
Thank you.
Are there any other questions or comments from the school committee? Okay. Well, I do want to thank everyone from the Medical Advisory Committee that came here tonight, really for the work you've done over the past 16 months or however long it's been, and help guide the district and help provide us the information to try to move forward and make any decisions based on the unfortunate situation that we're living in today. So on behalf of the committee, I do want to thank you all for coming out tonight and all the hard work you've done for us. I know you all have many things to do in your own lives, and you're all working as well. You're more than welcome to stay for the public comment section, but if you do have other commitments that you have, feel free to drop. At this point, we are going to open it up to public comment. I do want to reiterate that nothing is being voted on tonight by the school committee. We will have in our next meeting on August 30th, this item will come back up, and at that point, if anything is going to be changed with our current policy, we will vote it then in time for school to start in September. I know there are a number of people on this meeting. I'm sure that a lot of people that want to make comments. I just want to make a couple of quick points. I am going to hold people to one of the points in our policy that says, people are allowed up to 3 minutes to present, just to allow as many people to speak tonight without, being here till sometime tomorrow. I'll allow everyone to speak at least once, and then after that, look at allowing people to speak a second time if they choose to. This is a public comment. It's not a discussion. It's not a debate. It's not a Q&A. So this is just a public comment where people have the opportunity to provide their comments to the school committee. And I will also say that all speakers present in a respectful manner. As Superintendent Burkhead had said, we want to allow the community to speak, allow as much feedback as we can as we move forward with this. But at the same time, this is a meeting of business. So we need to make sure that we are respectful of anybody from whatever position they may take on this topic. I am, as people have been raising their hands, I've been trying to keep people in the order that I've seen them raised. We will allow everyone who wants to speak tonight to speak. If you raised your hand early on and I call on you later, I apologize. Zoom does kind of move the names around a lot, but I will. Anyone who has a hand raised will have the opportunity to make a comment. When I do call on you, you'll be able to unmute and just remind people to say their name and either address or school affiliation before they make their comment. And similar to town meeting, I'm going to keep a timer on my phone. I'll give about a 15-20 second warning before that 3 minutes is up. So the first person that raised their hand was M. Ramaposha.
Thank you. Hi, Michelle Ramaposha from Sedgwick Drive in Scituate. I'm wanted to comment to thank you for voting for supporting the science, following the science, and seeking out the best available research and listening to epidemiologists and infectious diseases specialists, and making decisions about masking and vaccination requirements and other protocols at the schools. And I trust that you'll ignore public pressure that has no basis in science to try to do away with masks as COVID-19 cases are rising among children throughout the country. And as Dr. McBride noted, we see that hospitals are struggling even without a big surge. So we want to be careful to avoid that possibility. I have two questions. One is about the masking recommendations that we received from DESE that said that vaccinated students didn't need to mask. And I just wanted to know if I know you're not supposed to answer questions, but if there's any chance that somebody could comment on whether you're expecting updated guidance on that. And the second question I had, if there's any chance that somebody could talk about ventilation in the schools. This has been listed by experts and epidemiologists as among the top 5 priorities for schools in preventing COVID infections. And Dr. Ashish Jha, he's the dean of Brown School of Public Health. He recently listed it as second to vaccines in importance because obviously it's an airborne disease. And I wanted to understand, whether all of the classrooms in the district have improved their ventilation, and is this something that's been prioritized? Thank you so much for all your efforts on behalf of the students. I appreciate the care and thoughtfulness that you've shown throughout the pandemic, and I trust that we're going to do well for this school district because you are all at the helm. Thank you.
And I did forget to mention, so I'll say it now, as we go through and catalog any of the questions that do come out on top of providing the PowerPoint that the superintendent presented earlier, we will, be sharing any frequently asked questions that we do receive to the community through the same avenue. Superintendent Burkhead, I don't know if we have an update on the ventilation or if we can have one for the 30th.
And I agree, Karen Long, that I know people have questions, and I'll document them as they go, because as we stated, this is a public comment and not Q&A. So I have noted that. And yes, we'll have a more comprehensive presentation on the 30th, similar to what we did last year before we start school. As we noted, the guidance is still trickling out, but certainly ventilation will be of a highest priority for us, and quality air, the air quality of our schools is something we certainly are working on, and we'll be able to report out at a later date for sure.
Okay, thank you. The next person was Lee Westward.
Hi, Lee Westward, 44 Amy's Way. First wanted to thank everyone. I know the school committee and superintendent, everyone who has worked on this has donated so much time to figuring this out, and it's not easy. At the end of the day, I might not agree with the decisions being made, but I think we all want the same thing, which is the best for our kids. So thank you. So question / comment around whether hospitalizations and deaths have been used as a metric at all instead of cases. I think we know the cases are surging, but from what I'm hearing, and I'm not a doctor and definitely don't have the latest and greatest, but deaths and hospitalizations are way down due to the vaccinations being so successful. So wondering if that's been taken into consideration at all. Also, wondering if the cons, which I'm sure they were, but the cons of masking have been taken into consideration. I know, for the older kids, it's a little bit easier, but I had a first grader last year, literally most days she would come home with a hole chewed through her mask. And I can only imagine that the chemicals she's literally ingesting into her body can't be good. So incidents like that, I'm just wondering if you've thought about that stuff. And then I guess what would make me, like, at the end of the day, we just want our kids back in school. So masks, no masks, I'm happy to have them back in school. But having more clearly articulated goals around, here's the baseline number of cases that we need to see, or just some hard metrics in place that would be a goal to work towards. I feel like right now I hear things like, we'll see what it looks like, or we'll keep our eye on things in the schools. Like, that is not reassuring. It would be good to know, like, we're looking for X number of cases, or whatever the metrics that you're using are, that we can all kind of rally behind. And then I know that there's been a lot of mention of hospitalizations for other reasons, but like outlining the objectives of masking, our assumption is that this is for COVID, not for other things. So if we're changing the goalposts, like, we need to know that, or, and not to be callous about it, but they shouldn't be considered as part of this, because the issue that we're dealing with is around COVID. So thank you. More comments / questions that can be answered either, now or later, but that's it. Thank you.
Great, thank you. So the next person to raise their hand was Melina Davidova.
Yeah, hi. I have a middle schooler and a high schooler, and I really appreciate all the science-based information coming out tonight and how it could shape school for next year. As a fully remote family from last year, our family's fully vaccinated, but of course, you know, we're concerned about the well-being of everybody, so we will follow where the science leads us. I just had a comment, perhaps it will be covered in the next meeting. Based on the plans, there was mention that you want all kids back in the building. My concern is the outbreaks that are happening all over the nation as schools are reopening, and there is quarantining happening. There is no mention in the plans from the presentation tonight about any online learning options for continuity of learning if the kids are quarantined, but not necessarily too ill, if at all, to learn from home. So I was hoping that might be addressed. And also as a final comment, on the last comment, Leah's mention about masks and toxicity of them. Cloth masks are great and cotton is pretty safe. You can also make your own. There's lots of great plants out there. So I don't think that should be a fear to worry about. But anyway, thank you so much. And I look forward to more.
Okay, thank you. The next person was Dan Driscoll.
Hi, my name is Jennifer Driscoll. I live at 9 Fieldstone Road, and I have 2 children at Hadley Elementary School. I am vaccinated, I have no political agenda, and I am simply a parent who wants what is best for my children, to not have their faces covered at school. We have an amazing town and community in Scituate and are capable of so much when we work together. Everyone is here tonight because we love our children and we love our community. Not only am I a parent, but I've also been a teacher for the past 17 years. As a committed and passionate teacher who truly cares about the well-being of my students, let me tell you all that this past year was the absolute saddest and most depressing school year on record. These children were sad, so sad. Teachers worked like crazy to be creative and innovative and rise to the occasion in every way possible, but it isn't enough. These kids were not themselves. Let me tell you what I saw every single day. I saw expressionless, muted children. I saw sad, masked students sitting in rows like zombies. I saw students fearful to even touch a piece of paper handed out by their teacher. I saw children not relating to others the way they could before. I saw fear and anxiety. There were bodies present, but no emotion and no joy. Never, not one time all year, did I get to see a smile. Education is not just about giving and receiving information and showing up. School is about constant interactions that cannot be replicated with a mask on. Kids need to love to learn, but instead they fear each other. They fear their teacher and they fear the air that they breathe. The masks are a significant barrier from learning. I hope everyone realizes that you don't learn the same way when you're masked. We've literally regressed 200 years in education in the classroom and reverted back to trying to simply fill the students with information rather than lighting the fire and passion to learn within. These past 2 years have been gut-wrenching for me to see this firsthand. Each day this year, I tried to start with focusing on the positive with my students, and I had to constantly remind them that this was in fact the happy place that you remember from previous years. We just need to work through this right now. Don't get me wrong, we did make the best of what we could. We held on to hope. We found joy in the smallest things you could ever imagine. But could these students and teachers be asked to do it again? This shouldn't be the expectation on our children moving forward, year after year. We are now on year 3 of finding less than ideal alternative ways to educate our children. People say that kids are resilient in regards to this pandemic, but what I saw was a group of children that were compliant and that liked to please their teachers and that stepped up last year. These adults have not seen what I saw. The joy, the fun, the reason we all love school was completely gone. Children are incredible and they want to please their teachers and they don't want to break rules. But the adults need to wake up and really think about how this impacts our children. We know that COVID is here to stay. How can we continue to do this to our children? At what expense on our children's education and well-being? Please stand up for our children. Let them learn and live with joy and happiness as they have all summer. Let's give them back what these kids deserve, their childhood and their sweet innocence.
Thank you for your comments, Ms. Driscoll. The next person was Courtney Dubois.
Hello, my name is Courtney Dubois and I'm from 5 Longfellow Road. I'm a parent of 4 children in Scituate Public Schools and I'm speaking today in support of DESI guidelines and parents' choice. Being a former public school elementary teacher, I've always stressed with my children the importance of listening to their teachers and following rules. This is why my children would never complain to their teachers about wearing a mask. Children were not masked during the 2018-2019 flu season, where almost 500 children died, which is more than the last year and a half with COVID. Thankfully, we now have highly effective vaccines that are doing exactly what they're supposed to do, not prevent cases from occurring, but prevent people from getting very sick and hospitalized. I'm wondering today, what is the off-ramp to masking and other restrictions if we send them to school with masks now, when Massachusetts has the 2nd highest vaccine rate in the country and the 2nd lowest hospitalization rate? We need to take this incredible progress we have made as a state and a town and allow our children the access to a normal school environment based on evidence on the ground. As a group of Boston-based doctors wrote in the Washington Post, quote, mask wearing for students and staff in indoor classrooms should be optional, not required, as long as COVID-19 hospitalizations, a more reliable measure of disease in a region than cases, remain low in a given district. The World Health Organization advises strongly against masks for children 5 and younger and recommends that the decision to have 6 to 11-year-olds use masks be based on local transmission rates. Now is the time to safely move forward and show the children that their hard work is paid off by demonstrating progress. Thankfully, they have been given the opportunity to enjoy a normal summer where masks have been optional at all camps, activities, and even at Scituate Public Schools' summer learning classrooms. This has been done without any COVID spread. The youngest population continues to remain the lowest risk for catching and spreading COVID. We have spent the last year and a half putting time and money into making our schools as safe as possible. Scituate Public Schools' ventilation and air quality have never been better than they are right now. This, coupled with hand washing, sanitizing, and all other protocols, have led to Scituate being in a great place. But this is by no means a one-size-fits-all situation, and every adult and child in a school setting should feel comfortable learning and teaching. This is why mask choice is the best fit. It allows those that are nervous or have personal family medical concerns to feel safe in a mask, and at the same time, allows those concerned with the development, speech, or mental well-being of their child to feel comfortable without a mask. We are now heading into the 3rd school year that COVID has impacted our children's education. My 7-year-old is already on an IEP and has yet to have a regular school year. In addition to not being able to breathe properly, he has not been able to make effective progress on his academic and speech goals due to not being able to properly have the services he needs with a mask on. We cannot start where we left off when vaccinating the community has been happening for 8 months now. There are no state mandates in place, and all children deserve to attend our public schools and to feel comfortable. Please consider following DESI guidelines in recommending, but not requiring masks when planning our school year, as other districts have already chosen to do. This is truly the best fit for the whole community.
Okay. Thank you for your comments. The next person who had their hand raised was Maureen Connolly.
Good evening. Can you hear me?
I can, yes.
Okay. All right. I'm not a parent of school children, but I am a taxpayer, an RN, and a former 9-year school committee member of another town. I don't pretend to be an expert, but I am capable of doing research And I would ask for a different recommendation that masks be optional. We have learned a lot since last March. We're in a whole different place. We have the vaccines. Sounds like a high rate in Scituate, a high rate for seniors, and seniors are the ones who had the most deaths. So that's important to look at. With these vaccines, we've had some breakthrough cases, but vaccines are working. These people don't end up getting hospitalized. And according to the Department of Health and Human Services, of the country's more than 919,500 hospital beds, COVID-19 associated hospital admissions totaled just 944 on July 24th. And that compares with 6,679 such hospital admissions in early January. So we've made a lot of progress. COVID and the research on it has been treated like a political football. There is a lot of fear mongering about COVID, and the reality is that there is a 99% survival rate. Many doctors don't agree with the CDC, but because of the regime that we are living under, are afraid to speak up. I know of many doctors and nurses on the front lines who are taking hydroxychloroquine prophylactically, but you don't see that on the CDC website, and it is working. I have heard many medical professionals say that we will never have herd immunity, that COVID is not going away, that like the common cold and the flu, we will need to learn to live with it. Dr. Daniel Stock of Indianapolis stated that the COVID-19 virus has animal reservoirs like the common cold and flu, so it is never going away. We have a greater chance of dying from the flu. And I am certainly not advocating for this, but why haven't we talked about masks for the flu? COVID presents very little threat to children. They don't seem to get it, nor do they transmit it. In the US, 4.2 million children have tested positive for COVID. That does not mean that they are sick over the past year and a half, yet only 0.008% have died, or 336 children. But we have no idea what the comorbidities are because the CDC does not publish that information. For example, did any of them have cancer, leukemia, etc.? During the flu season, 2018 to 2019, so let's say 6 months, 480 children in the US died of the flu. So we're talking 336 from COVID or maybe comorbidities in a year and a half, compared to 480 children during a 6-month time died of the flu.
Ms. Connolly, you got about 20 seconds left.
Okay, I've done more research. Can I speak a second time then? The CDC and Dr. Fauci have given conflicting, confusing information. The people in power are now saying wear masks, but yet we see them without mask on. Dr. To wear private work. Studies on masks, and all I could find was one done by some scientists from Duke that somebody else referenced. And all they did was look at children in schools with mask mandates and said they worked, but they did not look at a control group wearing masks. So they weren't able to compare anything. So the research was not good research that they did. Senator Rand Paul.
Sorry, Ms. Connolly, I'm gonna cut you off there because you've run about 4 minutes. If there's time, I'll let you speak again. If you do have the research, if you want to email either the school committee members or the safeandstrong@cit.org, we can make sure the appropriate people take a look at the research that you've done. Sorry, thank you for your comments and the research you've done and provided so far. The next person to have their hand raised was Robin Glazer.
Hi, Robin Glazier, 26 Persimmon Drive. I don't have children in the elementary school, and I do respect, the need for, elementary students' academics. I just would like to share that I have a kid in the high school, and we were recently chatting with a group of their friends. So this would be mostly sophomores and juniors. And we had asked them their thoughts on returning to school masked. And, they all said they're not thrilled about it, but unanimously, they all said 100% they do not want to risk returning to remote learning. So they want to wear masks to ensure that they can stay in-person schooling. And they expressed worry about what direction the variant is going to be taking. So I just, wanted to put that out there. I know it doesn't address elementary school students' needs necessarily, but that was a fairly large group of kids, high school students, and not one of them disagreed with that. They all were in the same boat in terms of their approach to this. So I just, I don't know if any high school students are here tonight to express what their thoughts are, but I wanted to share that. I think whatever the decision is that is ultimately made on masking, I think it'd be very important to establish across the school district norms around student behaviors and respecting other students who may choose to mask regardless of whether there's a mask mandate or not. I think that's going to be very important moving forward if it turns out to be an optional choice. Thank you.
Thank you, Ms. Glazier. The next person was Jennifer DeSabatino.
Good evening. My name is Jennifer DeSabatino. I have a son at the Hatherley School, and the most important thing I just wanted to comment on was that, like everyone else, I deeply appreciate the work and excuse me, Cindy, get a move, please. The work and the dedication that the MAC and the school committee and all of the town boards have put into this. It's a lot of work, probably beyond what most of you were expecting when you originally got elected. However, speaking of getting elected, I am really glad that everybody has a voice, and even for people I don't agree with, I don't want anyone to be silenced or to feel like they're being silenced. But in the end, in a representational democracy, which we have, it is the school committee's responsibility and legal obligation to make the best decision, not based on feelings, not based on emotional arguments, at least not solely, but on the facts and on the science. And the science really does not support, I understand the woman who was speaking before me had some things that, some data points that she wanted to bring up. For one thing, 99% survival rate doesn't mean much when you've had, in less than 2 years, 4 million people globally die of COVID. That's a big number. We've had over 800,000 people in the United States. That's a big number. So whether that's 99% or 50%, this disease, this virus, has an enormous impact. And we're at the scale of numbers where 99% is not necessarily a meaningful target. I do agree with the question to have published targets in terms of infection rates or hospitalizations or what have you. And I think that we need to pay careful attention to not only hospitalizations, but transmission. And the whole problem with this virus is that it is highly transmissible, especially the Delta variant. And it is not true. That is absolutely incorrect that kids don't spread it and don't get sick or die from it. Pediatric NICUs are being filled in other states with kids on ventilators with COVID. They're at capacity. And even though the ones in Massachusetts are not filled with kids with COVID, if COVID cases start to rise, kids who have trauma accidents or other respiratory diseases will not get the care they need because the hospital will not have the beds to treat them. And that was the point of Dr. McBride's comment. By the way, I especially appreciate Dr. McBride is my son's pediatrician, and I'm thrilled to see her here. She's amazing, and not just about COVID. She is on the ball and gets stuff done and is quick to diagnose things and knows her stuff. So the emotional arguments don't really cut it. I'm a teacher. I teach middle school. I had plenty of smiles last year. With masks, remotely, all of that. Maybe I'm just a goofy person. I don't know, but we certainly had smiles. Did I see a lot of flat affect? Absolutely. And I think most of that was due to isolation, not due to the masks. Just like all of us, the kids are annoyed with the masks. I'm annoyed with the masks. I don't like the masks, but I understand.
Yeah, and it's just that you got
Okay.
about 20 more seconds.
Thank you. I don't like the masks. I would love to see them gone for good. But right now, if you make masking optional, then it would infect, it's not just the kids who feel nervous, but the other kids in the school can get infected. And if you're making it optional at the high school or middle school level, they have younger siblings, and that's going to create a problem, and it's going to be wilder spread. Thank you. Sorry for going on so long. I was trying to be quite quick. Thank you very much.
That's fine. Thank you. The next person to raise their hand was Moira Feeney.
Hello. I am Moira Feeney. I am a recently graduated class of 2021 from Scituate High School, 16 Alexander Place. And I'm hearing a lot of things, and I feel like going to these meetings is incredibly insightful, and hearing all the opinions is incredibly wonderful to be able to attend these with ease. However, I'd like to first start by just saying thank you to everyone who not only helps with organizing these, but also everyone who attends, because it's important and we as students do appreciate it. A lot of the things that I'm hearing from adults, some of whom are teachers, some of whom are parents, I feel are largely inaccurate because they are from the perspective of someone who's not in the schools or not in the schools as a student. However, I do feel that your points are valid in the fact that we're all concerned and worried. And I may not be going into school again at Scituate Public Schools, but having just graduated, I can tell you that what everyone wants is just simply to be safe. We all are incredibly worried, and the fact of the matter is the masks are not the cause of any of these problems that we are seeing. They're the cause of not isolation, it is what they represent. And it's less about what they represent than it is what everyone around us is saying and feeling. When people are saying and feeling all these things, when the parents and teachers are stressed and are frustrated, it does rub off on us. And there's no helping that to some degree. I'd like to just say thank you so much for hearing all the voices, no matter what their opinions may be. But that I encourage everyone, teachers, parents, people who are not connected in any way, ask your kids and don't cut them off. Don't try to point a conversation in another way. Just listen. It's incredible how much a lot of kids, especially younger kids, older kids, no matter what, have to say. Because there's a lot of power in just sitting and talking, and it'll help in so many ways, because that is where I think it starts. We worry about these students' mental health, but the masks was never the cause. And everything that is being done here is with love for kids. So I'd just like to finish off by saying thank you for all you're doing, and just keep in mind that the students are just concerned with safety And at the end of the day, even if we're wearing a mask, we're still seeing our friends. And it's easier to do that and learn if we're not worried about being sent to a hospital. Thank you.
Great. Thank you, Ms. Feeney, for sharing your comments and also, coming to this meeting, even though you recently graduated. One of the benefits of having these meetings be remote is we've had a lot of student participation over the course of this year. And as you mentioned, any insight we can get at all is very helpful for the school committee and for the community. So thank you for coming tonight. The next person, and I apologize if I butcher people's names as I go, Keely Gango.
You got it right, yes. I first I had a couple comments. The first comment was to Katie McBride about her fact about hospitals not being overrun by COVID, but for other things. Isn't this whole masking situation specifically for COVID and COVID alone? Secondly, I think it was Mike Long who said the mask mandate in the schools were never lifted. So I guess I'm confused because my children, oh, sorry, did I have to say my address too? 748 Chief Justice Highway. It was never lifted. So I'm curious as to why my two children were in Jenkins, Gates, and Hatherley all summer long with hundreds of Scituate kids, including counselors, unmasked. Thirdly, I am confused on the vote itself. It seems like the DESE and DPH guidelines are misrepresented. They say that K through 5 is strongly recommended for kids. It doesn't say mandate, and there's no rules or regulations. It just strongly recommends. I did not see those words in your slides. The 2020 and to 2021 school year, we received several letters from Superintendent Burkhead citing DESE and DPH guidelines. These were the guidelines that we would be following as a community. No questions asked. We did that all year long. What changed here? Are we now disregarding DESE guidelines because some people believe they aren't strict enough? Are we now saying that the 4 members of our school committee and their personal beliefs and opinions on the matter of masking our kids trumps these state guidelines? That seems inappropriate at best, borderline careless, and a little hypocritical. The 4 members of our school committee aren't lawmakers, they aren't PhDs, and most importantly, they aren't the guardians to our kids. Is their vote and their vote alone now the new guidelines that we all adhere to? Last year, I remember several surveys that went out to staff and parents about their children's school year. Where are the surveys this year? I haven't seen one. I agree with the side that says most kids are fine wearing a mask all day. But what about the kids who truly aren't okay wearing a mask? 7 hours a day, 5 days a week. These are 5, 6, 7-year-old kids. Some have speech impairments, some have hearing impairments. Those kids are sent to school for an education and they will not get one this year. They will sit and suffer through the entire year. This is not a one-size-fits-all rule. There are exceptions. The staff and teachers have had ample time to protect themselves by getting the vaccine. It is the greatest protection of all. There is nothing more that they can do to keep themselves safe. I understand the parents who are worried about their physical health of their children. Thankfully, we are in a state that is exceedingly high vaccination rates. Our town of Scituate has even higher rates of vaccinations. I am not touching upon that data. I'm sure other people on that call will. The parents who are afraid for the physical health of their child due to the actual disease of COVID, I understand their comfort level by masking their children. They have that option to do that. What about the parents of the children who I just mentioned with special needs? Where is their option? The sole reason we send our children to school is for them to get an education. Some kids will not get that this year if they are forced to be masked. Please consider following DESE guidelines and strongly recommending that unvaccinated kids are masked. It is not mandated this year. There is no legality in masking our kids. Please understand and respect that. Thank you.
All right, thank you. I will address your question about the policy. So the school committee is responsible for making and approving any policy on the school district. So yes, the school committee would have full say over if masks are required or not. And the current policy that was in place last year does say that masks were required in school buildings. But that is why, you know, obviously we're four individuals who aren't doctors. And that's why we do rely on the medical experts, the administration, and the research that is done to make a final decision, as well as, you know, meetings like this where it was based specifically for the public comment in taking into account everyone's opinions on this as we go through and look at potentially voting anything on August 30th. The next person to raise their hand was Joan Whitaker.
Hi, Michaela Whitaker. Well, Michaela Whitaker. That's my mom's computer echoing over there. Okay. Sorry. And many people say that masks should be optional. I do not agree with that because well, I mean, why? I don't mind it, and I much rather keep myself and my fellow students safe than worrying about it getting itchy. Yeah, I don't like it. It's itchy,
I'm sorry,
it
Ms.
causes
Whitaker.
acne. So what? I don't want to be in a hospital. I'd much rather throw a mask than a ventilator.
I'm sorry, Ms. Whitaker, you're breaking up a lot as you're speaking.
Disorder. I'm hearing impaired, but my teachers have. I'm sorry?
You're breaking up a lot as you're talking. I'm sorry.
I'm sorry, my computer's audio is not doing the best. Can you hear me now?
We can hear you now.
Okay,
Yeah, much better.
thank you. I would as I was saying, I would much rather breathe through a mask than I would a ventilator. And have talked to a lot of my friends and fellow students, and they agree. And it's just, I'm hearing impaired, and my teachers have worked extra hard to make sure that I am getting everything that I need in order to succeed. And I see no problem in wearing masks. And I'm laughing, I'm smiling, I'm having fun just as much as I would without masks. The main thing that's keeping me happy is being able to be in person with my friends. And that's not going to happen if we don't wear masks and COVID spikes. Thank you for taking the time to listen to me. And I really appreciate all that you're doing. Thank you.
Thank you. The next person was Liz Logue.
Hi, thank you for having me and allowing me to put some comments in. I have two kids that are both at Cushing Elementary School. Due to their ages, neither one of them are able to be vaccinated at this time because they're both under the age of 12. I just wanted to voice my strong support here for following the medical science and for masking all of our children, especially in this age group. I can't speak for high school because I have elementary school kids, but certainly I just very strongly feel that, you know, especially with the new Delta variant coming, with reports of more kids getting hospitalized and COVID spreading so much more rapidly with the Delta variant, as we heard from the doctors earlier, there really should not be a choice of masking or unmasking. Why? Because the moment that you enable kids to be unmasked, it sets a standard. Some kids are not going to want to wear masks. Certainly, you know, if they see that their other people aren't wearing them, and obviously also just because of community spread. So we know that masking works when everyone wears a mask, not just some or a select amount. And certainly in the age group that we're in, no one is even able to get vaccinated. So really, I just wanted to strongly express my opinion there. And I think, you know, there's a lot of talk about parent choice. And to be honest, you know, saying that parents get the choice to choose whether their kids are masked or not masked takes away my choice as a parent. Yes, I can force my kids to wear a mask, but if there's other kids at school that aren't wearing masks, I can guarantee they're going to stop wearing them because they're going to see it. And or it puts a target on their back. So, and also they're just not as protected. So it's not a free choice here. We're talking about a pandemic that we've never seen before, and now with a new variant. And I just wanted to say I really appreciate everything that the committee is doing. I know there's a lot of strong voices out there speaking up against masking, so I just felt the need to come on here and say I strongly support following the science and protecting our kids. Thank you.
Great, thank you. The next person was Dan Gengo.
Hi, Dan Django, 748 Chief Justice, Cushing Highway. I have two students going into the Cushing Elementary School starting this fall. I have a second grader and I have a kindergartner. My second grader, he's kindergarten, half of it was canceled. Last year, he was in masks. My kindergartner, his first year of preschool, half of it canceled. His next year of preschool was prison, masks, plexiglass dividers, not playing with little kids. These are 4, 5, and 6-year-olds we're talking about, not 15-year-olds that have been vaccinated. These are little kids. They need to be around their friends. They need to be playing. They don't need to be afraid of touching another book that another student has touched. The numbers don't lie. 0 children in Massachusetts have died of COVID. That alone shows you what we're up against. Scituate by itself, 91% of eligible residents have had 1 dose of the vaccine. You want to look at 50 and up, 93.3% of Scituate residents, 1 dose. When is this going to end? We have people speaking about masks help with the flu and RSV. So are we saying masks forever? All summer, camps, summer school, no masks. Did we have any outbreaks with little kids? No. This has gone on too long. Last year, we sent multiple emails when the weather started getting nicer. Why are my kids still in masks? Jesse says so. That's the answer we got. Jesse says, strongly recommend masks. And both options that we've been given, my children are going to be in masks. Parents that are scared, they can mask their kids. That's enough. We need this to end now. Thank you.
Thank you for your comments. The next person is listed as WCMKW. If you don't mind just saying your name and either address or school affiliation. Oops. In person.
Yeah, it's Mike Westor. I just got a question. So I jumped on late. I only saw 2 options, and either option had the elementary school kids wearing masks. Are we not even exploring the option of no masks at all? Like, who made the decision for the 2 options? And maybe you said it again, but I guess I missed it. I thought this call was to hear parents' input. it looks like you've already made a choice on one of them that K through 6 are wearing masks. So what does the input matter? It seems like the decision's been made. It's already been predetermined. I guess that's what I'm a little confused for. If you're asking for public opinion and most people don't want the mask and all the polls and everything else, why have this if you're not going to listen to it anyways? Or let's do another survey and see if we get another 90% that don't want masks. And then maybe we could listen. That's it. Maybe I'm wrong. Has it been determined or not?
So no, it hasn't. Any vote that occurs would occur in our meeting on September 30th. And the two recommendations that came to the school committee tonight were coming from the medical advisory committee that we have with Superintendent Burkhead. I mean, at the end of the day, the school committee could make a different decision, but those are the two recommendations coming towards us from the medical advisory committee.
Can parents submit a recommendation? I mean, what they want?
Well,
to be voted on as well.
I did say at the beginning of the meeting that we've received dozens of emails so far, and people can either email the school committee members directly, they can email Superintendent Burkhead, or last year we had set up an email address that was safeandstrong@cit.org that people can also submit their information to there as well. But I would say yes, there's been a lot of feedback from the community that's helping drive, at least some of the decision making that I'm making, and I know the other school committee members as well.
Okay, thanks. And again, I appreciate everybody's time. I know it's a pain. So, I mean, no disrespect. I just have a difference of opinion. I mean, I want the kids with no mask.
Yeah. And we appreciate that feedback, Mr. Westbrook. The next person with their hand raised was Tom Esch.
Hi there, Tom Esch. We have a third grader at Cushing. And I guess at the outset, I want to add my thanks to those of others, to the school committee and to the medical advisory committee in particular for their commitment to the safety and well-being of all students. And I'd also applaud the school committee for providing this opportunity to comment in this format. I think it's a good and healthy thing for the community, and I applaud you for that. I also want to acknowledge the students who have spoken up at various times over the last year and a half, but in particular tonight. I think it speaks volumes to their commitment to the community and the very evident care they have for their friends, which I think is excellent. I also want to say, I think it's pretty clear, everyone agrees that no one really wants masks. That much seems fairly obvious to me. I don't think there's anyone out there who sees masks as a net positive. I think we'd all like to be able to move past that. But I think in the interest of keeping all kids as safe as possible, and consistently keeping them in school, it's really in the best interest of learning and academic excellence to lean in on masking. And I think more masking, I think, ensures greater safety. It's been observed by a couple of people that COVID is here to stay, and that's not a point I think we should all concede so willingly. I think it's pretty clear from a growing number of public health folks that that vaccination and masking in combination will go some distance in suppressing spread and really knocking this thing down. And I think it's important for us to keep our eye on that prize. I guess I would echo the point on consistency, which has come up in other ways. I think it's so important, given the extent to which some families really rely on schools for everything from basic nutrition to mental health to some really basic forms of support. I think keeping kids in school as consistently as possible is really the abiding goal and should be a guiding principle. And I hope the school committee, with the guidance of the medical advisory group, is able to keep their eyes firmly fixed on that. I'd also like to applaud Michelle Bobert and the team of special ed folks. Our experience was that actually our son working with a speech therapist, she did a terrific job in looking for creative ways to help him achieve goals and to keep moving along. So under less than ideal circumstances. And I think Mrs. Bobert and her team deserve some credit on that point in particular. Thanks, I guess, for the opportunity to comment. Thanks again to everybody for their service. And I look forward to hearing how things shape up in the next couple of weeks.
Great. Thank you, Mr. Esch. The next person was Kristen Scott.
Hi there, am I being heard?
Yes, I can hear you.
Kristen Scott, 93 Lawson Terrace. I have 2 children at Cushing. As mentioned before, there's science to support any argument, so I won't waste, anybody's time referencing the peer-reviewed data and science that I follow that really supports optional mask wearing for school-age children. Frankly, it's apparent to me that the decision here has already been made, contrary to what I'm being told. I sit here wondering, do parents' opinions matter anymore, or is this a farce? I have elementary school children, as I said, and as far as I can see, my kids are going to be in masks because those are the only 2 options that were presented here tonight. I guess I wonder, what's the off-ramp to mask wearing? What's the goal? I lack confidence, I suppose, when there is a clear either inability or, I guess, refusal to define such. Each time I hear, and I must have heard it 20 times tonight so far, the good news is that, we're all back in school. It's like each thought is prefaced with, the good news is, and I suppose I'm hearing that as a veiled threat of, mask or else. The contrary to all the, prefaces of the good news is that the bad news is that my kids don't want to return to Scituate public schools, and their ability to learn while they're masked is distracted at best. And it's not about feeling, excuse me, annoyed about masks. It's about the fact that my children are physically uncomfortable and have a constant awareness, and that is a detriment to both their emotional and their academic health. And my kids used to love school. They're rule followers. They want to please their teachers. They want to please their principal. They will never, ever tell a teacher how uncomfortable they are, but they do come home upset, crying, and reluctant to wanting to return to school. And it's very upsetting to see. And, this whole idea that, there isn't a one size fits all. I suppose I see it as following the DESE guidelines, which again, you've all been very careful about doing all year long. Last year, following DESE guidelines sort of is that one size fits all, because those guidelines give options that satisfy the greater majority. It gives the parents who don't feel safe the choice of putting their children in any type of mask that they like. And the parents who feel really upset, myself being one of them, the choice to send their kids to school in a way that's comfortable, healthy by my standards, and allows academic involvement and social emotional learning. And it's very upsetting to me to see the 2 options being presented tonight as something that truly doesn't work to my family's advantage as an elementary parent. It feels very unfair, and I would like to have a choice. I believe that I know what's best for my children, and I would like to have the ability to protect them the way that I see fit.
Okay. Thank you for your comments, Ms. Scott. The next person who had their hand raised was Lauren Schlegel.
Hi, sorry, I'm just getting situated here. I'm Lauren Schlegel at 109 Maple Street. I'm mom to 2 elementary students and another that will be in kindergarten next year. Thanks for the opportunity to speak, and thank you for your time. I am pro parental choice for masks in school. I believe and trust in science, and I am fully vaccinated. Sorry, this is so hard. I have absolutely no alternative agenda whatsoever, and I am not anti-mask. What I am is a mother who loves her children and is concerned for their overall well-being. And I mention all this because it's really hard to speak up for parental choice, as there are so many negative and unfair associations that go along with it. I am here for one reason. I want to choose if my child's face should be covered for 7+ hours a day at school. We will now enter our 3rd academic year with much more control over this virus and the 2nd highest vaccination rate in the country. So why aren't we taking advantage of this and loosening up on our kids when they're the least affected, but to date, they've had the harshest mandates? And I'd like to ask the school committee, if other towns are choosing mask optional, what makes us different? If we currently have 8 child cases in town and we're masking, what would the metrics ever be to go mask optional? I also want to ask the other parents hesitant to speak up, please, please do. We need you now more than ever. Thank you so much.
Great, thank you. And I would echo your last point. I mean, we want to hear from anyone and everyone from the community that wants to reach out. So if there are people that feel, that don't want to speak tonight, to feel free to email the members of the school committee directly, and we'll be more than happy to respond or take everything that is sent to us under consideration. The next person is Alexa Houghton.
Hi, thank you so much for everybody. I actually was really terrified to follow Tom Esch because he basically said everything I wanted to say, but much more eloquently. I did want to add one more point. I wanted to thank all of you for your time, but that as a family, oh, sorry, I'd never said, I have a high school student and I have an elementary son who has special needs and who last year I kept remote. And I am thrilled that he will be able to go back to school this year, hopefully with everyone masked. We are a family who actually had COVID, as safe as we kept ourselves last year. And we know exactly how it was transmitted to our family, and it was transmitted with one person masked and one person unmasked. And that terrifies me. And I ended up in the hospital for 4 days. So I can tell you that this is not a joke. And so I see those parents who want me to keep my children masked because I want to keep them safe. I'm telling you that it is possible to transmit this way from personal experience. And perhaps if we can offer the parents who want to keep their children unmasked, I'm sorry, the parents who would like to keep their children unmasked, the option then to keep their children remote this year. Thank you.
Great, thank you. The next person comes up as Hillary iPhone.
Hi, this is Hillary Tyson, 10 Wamsutter Road, and I have a child going into 3rd grade. I love the passion at this meeting. I love it on both sides. So it just shows that we have a community that all loves and cares for their children, and that's wonderful to hear. I empathize with everybody. I know that this is difficult on both sides, or whatever side you're on. I think it's been a very difficult time for everybody. I really want to acknowledge and applaud those students who are attending this meeting and sharing their opinions. I think it's so valuable to hear from students who are in school every day. And I can say that when I was in high school, I never attended a school committee meeting, and I didn't have to deal with a lot of these really difficult things that these kids are having to face. I, for one, know one family, not in Scituate, who has a child who had COVID, and that child is a long hauler. So it does scare me and my family. I respect everybody's opinions, but I hope that we'll make the best decision for our children to keep them safe and to keep our teachers safe. Thank you.
Great, thank you. The next person is Lori Withrow.
Hi, Laurie Withrow, 62 Ann Vinyl Road. I didn't come with a prepared speech beforehand, but I did come to listen. And I wanted to listen to what everybody had to say. I was a little disappointed in the presentation, as it did seem like someone else had also mentioned that only 2 options were being brought to the table. And it is pretty clear from listening to people tonight that the option of mask optional is something that not only do some people on this call want, but other towns have also voted in as one of the options. I also thought that we would have seen more data being given during the presentation, because I thought that's what we were coming to listen to tonight. But it seems like only those 2 options were being brought to the table, and that people were sort of, being made to prepare that that's it, K to 6 or pre-K to 6, that you are definitely wearing masks. But if you look at what's being voted on in other towns, mask optional is definitely something that has been voted in. So if you look at what Charlie Baker is saying, that he is not mandating this. So I just want to make sure that that's clear, that that is not definitely what is being told to the towns, and other towns have come forward and voted it for optional. But again, I'm just want it presented that I did come to listen to everything. And I hope that everyone on the call, including the administration and teachers and school committee, are also doing that and not just deciding that these are 2 options. I heard somebody say that, this is all for academic excellence. And, I've brought it up on other calls before. We're 105. We went to 105 in rankings during masks. So we need to look at our excellence in academics, and are we doing everything? Is our reading of these reading for little kids in the speech and everything that needs to be done for these little kids taken care of? So please put the academic excellence and look at that data. And I'm saying this as fully vaccinated. My husband, myself, our 20 and 22-year-old, we have a 10-year-old who gets speech in schools, but we actually don't worry about him with the COVID, as we're all vaccinated in the house. I do 100% worry about his social, emotional. I worry about his mental health. And I am concerned that, I don't know why we don't have someone, some type of psychologist, a mental health person on your committee, because I did not see that listed. So thank you very much. And I hope everyone is listening to what everybody has to say. Thank you.
Great. Thank you, Ms. Withrow, for the comments. The next person was Christina P.
Hi, can you hear me?
Yes, I can.
Okay. And I hadn't planned on speaking either. I work at Gates and I have 2 children, one at Gates and one at the high school. Fortunately, my kids and I are all eligible to be vaccinated and have been. I do still, however, support masks in school, even for the older kids. And as people have said before, as much as no one likes it, I know at least my kids and most of their friends at this point, it's become commonplace. We wear them now. We've started going back to wearing them in Shaw's and stores, and I've seen more and more people doing that as the cases have increased. I believe the town said this morning that of the people that are positive, that it was close to 50% that are positive vaccinated. So we're doing everything we can. One concern I have is how with mask choice, just the logistics of how teachers are going to police which parents have chosen for their kids to wear masks, especially like the 6th graders and they're going from class to class. if it's the parent's choice, the child wears the mask, it seems difficult logistically to ensure those kids are going by the parents' desire. I also know people have said, they want to protect their children their own way, but I know with the younger kids, as of right now, there is no way to protect them other than masks because the under 12 can't get a vaccine. So they don't actually have protection. And I believe they said every county now in Massachusetts is substantial or high transmission and increasing, which the CDC recommends indoor masks, vaccinated or not, which is why we've gone back to wearing them indoors. I know some towns have not mandated it and said they'll be optional, but there are towns that also have mandated it. And as Scituate has gone from 1 case to 9 cases to 18 to 26 the next week, I think we still just don't know how this is going to pan out. And my concern is that, maybe towns do mask optional and we see it goes badly, maybe it doesn't, but it seems to me to be worth, I think as Superintendent Burke had said, giving it a start with the masks, see how things are panning out. If the numbers are leveling off, maybe then you let up. But as things are increasing, it just doesn't seem to make sense to me with the younger children not eligible to be vaccinated. Once they can be protected and the parents have the choice to vaccinate them, then it would seem to make sense. I know there's a lot of opinions on it. But as an adult, and I know my older kids just want to be safe, want everyone to be safe. No one wants the mask, but I would like to see them to start off and just see how things are going. And I know it's a moving target, and we don't even know that DESE might not come back in 2 weeks if cases are going up and change their recommendation. So I think it's hard, but I think we'll know August 30th. We'll probably be telling also where things are going. Anyway, that was my off the cuff comments. But I appreciate everybody who's working so hard on this. It's not easy. It's not an easy decision, and everyone's been working very hard. I appreciate it. And I appreciate all the opinions. Thank you.
Great. Thank you. The next person is Barbara Whiteshirt.
Hi, I'm Barbara Weichert. I'm at 10 Cherry Lane. I have 3 kids in the high school, as well as one who just graduated this past June. All of them are vaccinated. However, 2 of my kids also have cystic fibrosis, which even with the vaccine is putting them at higher risk. The latest recommendations from their doctors at Children's, as well as the CDC, is that everybody in our household mask, even though we're vaccinated, to protect them. Their friends have all come to me independently and said they're willing to mask to protect their kids. They don't want to protect my kids. They don't want them to get sick. I know my kids aren't the only ones in the district who can't do anything else to protect themselves. And I would bet almost any child you asked would say they want to protect their friends. So I'm just kind of saying, thank you for considering everything, but please don't take away the right of kids to have that extra level of protection when it really could be a life or death matter for immune compromised and pre-existing conditions. Thank you.
Okay. Thank you. The next person is Paul Scott.
Thank you, Chairman Long. This is the second meeting in a row that I've spoken, and it's getting frustrating. Last couple of weeks ago, we talked about how we were going to have a very transparent, open conversation about curriculum. And then I become aware last week that Superintendent Burkhead has apparently or conveniently postponed any discussion until August 30th, right before school starts. So then I hear that we're going to talk about the mask issue tonight, that it's going to be an open discussion, that parents are going to have an opportunity to talk about what's best for their kids. And, we're left with 2 options, neither one which allows my kids or me to make that decision. I have 2 kids at Cushing. Clearly, they are going to be masked. We're wasting everybody's time tonight pretending to have an open discussion about what the school committee is going to do. Mr. Long, you know that you're not going to choose option 3. None of the committee members are going to go outside the 2 options that were presented tonight. And again, last week, Burkhardt says, oh, we're going to put a lot of time and effort, and we're going to come back with whatever options make sense and leave it up to the committee. Well, that's all BS, because clearly the decision's been made that anybody under 6th grade or 6th grade is going to be masked. So let's not pretend to be an open, transparent, caring committee that cares about what parents think. Make your decision, cover your ass, but don't pretend that it's anything more than that. Thank you.
So Mr. Scott, on your curriculum comment, we had said a couple meetings ago that we were going to move that out. We originally planned on doing it on the 9th. We moved it out to the 30th. And while that's going to be the start of the curriculum conversation, I do want to be clear that, you know, curriculum is something that we're going to discuss over the course of the entire year. And it's not something that we can fit into one night, because curriculum is, you know, hours worth of conversation and documentation to go through. In terms of tonight's meeting, I mean, one of the biggest things that we do want to hear is the community feedback. At the same time, we want to make sure we make the best decision for our town, our students, and our staff, which is why we did hear from the Medical Advisory Committee. I know Superintendent Burkhead and they are going to be meeting on a regular basis ongoing up until then. And the reason we're not making a decision tonight is to make sure that we do have the full breadth of information that we can have right before school starts. I know some school committees have already made the decision that they weren't going to wear masks, and then they're going to revisit the topic. So, you know, I would disagree with your comment that we want to cover ourselves when we say this, but we do want to make the best decision based on the science and everything that is in the research and everything that is out there. So whether it's mask or no mask at any level, you know, we're not making a decision on the fly. We're making the best decision that we can make with community feedback, with medical feedback, and feedback from our staff and our administration as well. So the last person to have their hand raised is Ms. Connolly. I know you sent us an email either today or yesterday, I forget which day, I apologize. I'll give you 30 seconds more before we wrap up public comment and, for tonight. I don't know if she's there or not. At this point, I am going to close public comment for the night. As I had said earlier in today's meeting, we do want to hear feedback from the communities, whether it goes to Safe and Strong at sit.org, whether it goes to the Superintendent Burkhead, it goes to the members of the school committee. We do want to get that feedback and make a final decision on the 30th, whether it's one of the two that came up tonight, or, you know, based on the science and the research, what our advisory committee comes back with, you know, whatever the options are at the time that we make the decision. So I do hope that people do continue to reach out. As I said, we've received dozens of emails so far. I read everyone that comes in. I try to respond to as many as possible, but everyone is read and considered as we go through this process. So the next item on our agenda for tonight's meeting is correspondence, which we didn't have any of. So it would be the warrants with Dr. Dutch.
So we do have one warrant this evening. It is warrant S210812. Total amount of $202,755.60. Outside of our local budget in the revolving accounts or grant funded accounts, we had $19,936 for Linda Mood Bell, which is training as a school for training for a student, and that came out of the IDEA special ed grant. We also had $6,922 for Buttonwood Books through SEF donations. Through our local accounts, the taxpayer funded programs, we had $20,126.38 for Dr. Franklin Perkins private school tuition, $49,630.72 for utilities, electrical utilities. $14,800.92 for contracted heat services. $10,229 for an evaluation program. $15,934 for copier supplies. $6,110 for Wilson Language Elementary materials. $11,510 for custodial supplies and contractual services, specifically cleaning supplies and air filters. And just to kind of summarize, you see some of these larger ticket items are related to the ventilation systems and making sure that they are functioning. So you'll get more detail on the 30th about what we're doing to ensure air quality and the safety of students and staff. But you can see some of those expenses are happening now because we're purchasing those materials. Okay, so if there's any questions, I'll be happy to answer those.
Yeah. Are there any questions for Dr. Dutch? Okay. Thank you for reading that into the minutes.
Thank you.
Is there any other business that members of the school committee wanted to bring up tonight? I will just remind the community that we do have one opening on the school committee. Anyone who wants to apply for that position can do so through the Board of Selectmen office or by emailing Lorraine Devon. All applications need to be in by 4:30 this Friday, August 20th. And then we will have meetings on September 8th and potentially September 9th to interview anyone who applied, with a vote with the Board of Selectmen on September 15th to appoint a new member who will serve the remainder of Mike Hayes' term, which ends next spring. So that being said, our next meeting is August 30th, where we will have the new teacher introduction to school handbooks, an update on mass, as well as a introduction to the curriculum with our new assistant superintendent. Is there anything else from the school committee? If not, I will entertain a motion to adjourn at 8:26.
So moved.
Second.
Thank you. We'll do a roll call vote. Gates,
Yes.
Brandolini,
Yes.
Lindblom,
Yes.
and Long, yes. Thank you, everybody, for coming to tonight's meeting. Have a great rest of your night.